crisis of mental health in this country, actually. 23% of us have some kind of mental illness in a 1 year period. So that's almost 1 in 4. It's astonishingly high. And levels of mental ill health in a population are really closely correlated with income inequality. The more unequal countries have a much higher prevalence of mental illness. When we first wrote about this in the British Journal of Psychiatry, a psychiatrist wrote in and said, do Pickett and Wilkinson really believe that 23% of the British population have some kind of mental illness? Aren't we just pathologising ordinary emotions and labelling people as ill when they're not? And I thought about my immediate sort of family and my circle of friends, and I thought 23% might be an underestimate. We've got everything: anxiety, depression, suicide, addictions, self-harming, bipolar disorder, autistic spectrum disorder, you name it. We are a fun bunch of people to hang out with. But the point is not whether or not we sometimes label somebody as having a disorder when they don't. We say a child has attention deficit disorder when actually they're just, a bit disruptive, or whether we label somebody as clinically depressed or not. These measures of mental illness across different populations are measures of real distress. They look at symptoms, they look at people's reports of how they're feeling about things. And wherever we put the cut-off point for saying someone's clinically ill or not, we are seeing massive differences in population levels of mental ill health or lack of well-being closely related to inequality. Now that suggests that however much we spend on mental health treatment services, we equally need to do something about preventing that epidemic of mental ill health happening in the first place. And we believe that inequality is a direct cause of people's depression and anxiety, of their narcissism, of their addictions, even of schizophrenia and psychosis. So we need to reduce inequality in society to deal with the root causes of those very, very distressing problems. But of course we also need a lot more money to be spent on mental health for children, for adolescents, for adults, for elderly people. All segments of the population are suffering from lack of access to proper treatment. If these were broken legs, we'd fix them. But when it's broken minds, it's just too easy for us to turn away and ignore them. So we do need to sort of be voting for people who will put mental health on an equal footing with physical health, and for parties who will fund the NHS properly. And it's been said on this panel before tonight, but I will say it again. Governments can find the money to do the things they want to do. And if they want to save the NHS and reverse the privatisation that's gone on, they can do that. They can do it through progressive taxation. They can do it by going after tax avoidance, tax havens. They can do it through all kinds of measures. They can choose to stop spending on the things that most of us would not support. And they can find the money to do the things they want to do. Someone said, we are one of the richest countries in the world, and yet we choose to ignore the health and well-being of a vast proportion of our populations. We could spend a little less on Trident and a little more on ourselves.